Hi everybody, it's Kevin Kane here, healthcare organizer at Citizen Action of Wisconsin. I just wanted to follow up on today, January 16th, the day after Governor Walker's State of the State, to go over some of the biggest changes, the biggest issue that Governor Walker has to face this year, especially around healthcare policy, and that is around the issue of Medicaid. And so, some of you guys, those who watched Walker's State of the State last night, may have noticed that healthcare didn't really come up at all. Sort of surprised by this, but at the same time, we're kind of thankful. It's a really big deal. I'll explain why this is important in a minute, but a couple of really major issues around Medicaid. One of the reasons we suspect that he didn't really say anything is that Republicans are all over the board on this issue of Medicaid. Many of them don't like it, but most of them recognize that it's necessary. Robin Vos this week, the Assembly Speaker, representative from down around Racine, came out and said that he probably wouldn't be in favor of expanding Medicaid. Yet at the same time, we have two other Republican governors, Jan Brewer from Arizona, as well as the governor from North Dakota, this week, that said we are going to accept this Medicaid expansion. We're going to help expand this under the Affordable Care Act to cover more people. So a little bit of backstory of what this is. Under the Affordable Care Act, Medicaid, here in Wisconsin, it's known as Badger Care. Medicaid is expanded to include more people to help make sure that it fills the gaps in the program, especially around people who are childless adults or just over a particular income limit. Here in Wisconsin, it's really going to help fill in the gaps of Badger Care, again, especially for those individuals with childless adults or who had children but are no longer part of it. So this is part of the Affordable Care Act. Since the Supreme Court, states now have the opportunity to say, we don't want this money, we're going to completely reject it. It was not part of the original Affordable Care Act. They did not have the opportunity to do that. This is an addition the Supreme Court decided to add, and so it's a little unclear how it's supposed to work out. It's generally understood that Governor Walker has to make this decision around February because it needs to be reflected in the budget he's about to put out. So because he didn't say it yesterday at the State of the State, we expect that he's going to announce it around the budget address that he's going to also have around the week of February 11th. Now, he could say this at any time. He has the precedent of making big announcements out of the blue, sometimes out of the state itself. And so this could happen at any point, but this, again, is a very big deal. What this means is it's roughly $12 billion of federal revenue, our tax money, coming into Wisconsin over the next 10 years. Wisconsin's already ranked really low on how much of our tax dollars we actually get back from the federal government. So this would be an opportunity to actually reinvest in our communities with the money that we're already paying. So it's $12 billion over 10 years, give or take. Our estimates are going to show that this is going to save Wisconsin hundreds of millions of dollars. Their argument that it somehow is going to cost Wisconsin does not hold any weight whatsoever. In fact, this money is set to help cover over 211,000 people in the Badger Care program that currently are either on the waiting list or they don't really have any insurance whatsoever. And so this is a large number of individuals. On top of this, it's going to help create over 10,000 jobs in the healthcare system. I mean, we need home care workers and nurses and doctors to help cover people. And so this additional revenue would go a very, very long way in making that happen. On top of that, it's actually going to help keep taxes low for our businesses. Because if low-income employees don't have Badger Care as an option, what they're going to do is they're going to go to these health insurance exchanges. And if they work for a large employer who doesn't offer doesn't offer health insurance, that business is going to see themselves faced a tax penalty for not covering their employees. This Badger Care was supposed to be an option for them to help make sure that they can get something and the burden doesn't fall on businesses who are unable to pay for it. So it was supposed to address this issue. Walker would actually be raising taxes on businesses by about $120 million if he rejected this funding. And so there's a number of different... We have a little bit of time left to push this issue. Citizen Action is going to be working with allies across the state, doing a number of activities to push this issue. What you can do is you can share this video first, but also you can check out our Activist Toolkit. Now, additional videos and the Activist Toolkit will be posted below this video, but this is going to include things that you can do from home, such as we'll include 50 tweets, 50 tweets, over 35 Facebook posts. We'll show you how to post them over an extended period of time to schedule them. You can invite Citizen Action to come to your location, host an event, invite us. You can have a webinar or conference call that we'll join and make sure that we help tell your friends and neighbors why this is important. Additionally, you can join our Thunderclap, which is this awesome social media tool that helps spread the word, as well as writing letters to the editor. All you have to do is type and click, and we will send it to the newspaper of your choice. So we are trying all sorts of different ways to help get the word out. Check out the Activist Toolkit, get involved, share this message. We have a short amount of time to do a lot of benefits to Wisconsin. Save lives, help cover people, reduce the number of uninsured, reduce how much Wisconsin spends on uncompensated care, reduce taxes. It's a win-win for everybody, but we just need to convince the governor. So, again, this is Kevin Kane at Citizen Action. Please share this video. Thanks so much. Bye-bye.